Regi and I, we had this dream of working in an area individually from our childhood. So we knew that tribal areas all over India are geographically isolated and they need lot of healthcare facilities. They lack a lot of healthcare facilities. So we looked at the health statistics, whatever was available at that point in time, and the studies, and shortlisted 3 places in tribal areas in Tamil Nadu, which were furthest from a healthcare facility, and Sittilingi happened to be one of them. We listened to the people and we realized that there is a need, and we decided to stay on.
We came to Sittilingi, which was in the middle of the forested area, and the people here were very friendly. I don't think they believed that we were doctors who wanted to work here, because the only doctors they had seen were in the occasional films where they appear in suit and coat and tie and things like that. So when we came with our very earthy attire, I don't think they believed us that we were doctors, but they were very friendly and welcoming. And gradually over the years, they accepted us as doctors because they found that they could come to us with any illness and we could sort of cure them. So when we came here, we actually had no money. So we just took a piece of government land, encroached on it, literally. And the people here built us a small mud and thatch hut, which for the first 3 years was our hospital, where we did basic care, attended deliveries, did small amount of surgery and things like that, trying to help people. And then as our work, we approached funding agencies, we got some amount of money, and we built a 10-bedded hospital. But even when we built that hospital, we were very clear that it should vibe with this area, and tribals should not feel intimidated by coming to a large structure with marble and glass and all. So we have tried to keep it that way. We do all our buildings in a very sustainable way with soil cement blocks, and we have expanded from a small hut to a 35-bedded hospital with an operation theatre, an ICU, and a labour room and neonatal care. And we are the only secondary care hospital in about 100 kilometers. So we have a large drainage area of more than 1 lakh people who utilize this hospital, most of which are tribals or deprived communities. We take health to the people. So one of the best examples we can give you is about COVID and COVID vaccination, where we persuaded the government and took vaccines into the villages, into the farthest houses, and we got, I think we have done about 98% vaccination.
When we came here, there were mothers dying in childbirth, and then the infant mortality was 147, which was unlike the general Tamil Nadu statistics, which is Tamil Nadu being a developed state, even then, compared to many other states. But there were pockets like here, which had a worse, which had worse indices. We sat with them in a participatory training, where we learned from each other, and they started working. They are all farmers, and they started working voluntarily in the village. And they looked at just 3 things. One is the nutrition, about nutrition, and how to prevent malnutrition, or if it comes, how to treat it, respiratory infections, and diarrheal diseases. And these 3 put together were the major causes of infant mortality and under 5 mortality all over India. And they also looked at how to have safe deliveries. So these 4 things they looked after, and in a few years, in early 2000s, they brought down the infant mortality to 20 from 147. And this is not because of the hospital, not because of any of us. No, it is because of the community, the so-called not formally educated women from the community. If you have to improve the health of any community, then agriculture, what we grow, what we eat, how nutritious it is, our livelihoods, our economy, our awareness about our rights, and how we go about it, and also the local governance, all these are major parts of health. So the community here, what you see in Sittilingi is a collective effort of all the people here, how the community join together and work towards that health.
So I think in the first 10 years we were concentrating mainly on bringing down mothers dying in childbirth and children dying before 5 years, which involved a lot of work with the community, empowering the community to know what are the problems and how to counter it. But after 10 years, when we had brought down our infant mortality and our maternal mortality, we were thinking that this is not enough. So we took a padayatra to all the villages we were working, sat down with the people, discussed with them, and said, what can we together do to help this situation? And there were many problems which came up. The biggest being farming, saying that farming is a loss and you have to help us with this. So we were talking about organic farming because we said it is good to make profits, but it is not at the cost of the earth and the insects and the animals. I know nobody believed us, and for the next 2 years we were only talking and nobody actually started doing organic farming. But after 2 years, about 4 farmers joined. We realized that through organic farming we were able to persuade them to get into millets, and for us millets is a big thing because we think that going back to traditional foods is the only way that a society can become nutritionally sufficient, nutritionally independent. And over the years we have been able to mobilize that, and we have been able to realize that, and I think most of the tribal families here have at least one meal of millet. We have not seen child malnutrition and adult malnutrition and anemia for a long time now, because I think the key was to change that diet. It took time. It took about I think 20 years to do that, but I think that was worth it because it's much better than any pill which you can give them. Changing the habit of a population.